After you've had a root canal treatment done, your tooth can be very sore to chew on. Please refrain from chewing on that tooth for approximately 5 days. This will allow enough time for the tooth to respond to the treatment that's been done on the tooth. Root canal is considered a surgery just like any other procedure, so there is healing time that needs to take place. Take the directed medications that Dr. Miller and staff have directed you to help with any inflammation that occurs at the end of your treatment. Sometimes it's something just as easy as pain management medication to help with any discomfort. If you experience any swelling at the end of the root tip, whether it's on top or bottom, any swelling at all within the first 24 hours, we do want you to call our office immediately so we can evaluate the situation and see why there might be some new swelling that's happening. A temporary filling sometimes is placed inside that root canal where we were able to access those canals. And if that is the case, after the healing period, which is determined by Dr. Miller, that at some point will need to be removed and a final restoration will need to be placed. After the root canal is initiated and completed, the tooth then is now weakened. Once a blood supply is removed out of the tooth, it does become brittle and it can crack very easily. A lot of times if a crack happens, we don't know how deep the crack goes. We don't know if it will go into the root or way below the bone. If that were to happen, then we end up losing the tooth. It becomes unrestorable. And then you have now just wasted treatment on the tooth and will possibly lose the tooth. So we do recommend having a crown placed on that tooth. You won't want to chew anything hard like nuts or popcorn until it is reinforced with a crown onto that tooth to prevent any further cracking that might happen at that time.